So thank you for joining me on my ablative laser journey. I had erbium YAG laser about 2 years ago now, and I've been wanting to share my experience with this cosmetic aesthetic procedure basically since I got it. But I held off because I wanted to have more perspective on the whole journey that I went through. So thanks again for joining me today. We're going to start off with just a brief explanation of what erbium YAG laser is and what laser is and how it fits into the electromagnetic spectrum. Then I'm going to take you through sort of my journey, the first few months that I went through in my wound healing, kind of what went well and what didn't quite go so well or as expected. And just a reminder that this is my personal experience. 100 of us could go out and have this procedure done and we'd all have a different experience. There was a different, you'd have a different doctor, you'd have a different piece of equipment, and your pathophysiology would be different. So I just wanted to remind everybody that this is my unique experience and yours could be totally different. So if you're interested in this video, I'm so glad that you're here. And I'm going to get started just explaining a little bit about the electromagnetic spectrum and where erbium YAG laser sits on that spectrum. This is a rather crude drawing that I put together of the electromagnetic spectrum, just so we have a reference point of where the erbium YAG laser that I had done sits in relationship to other modalities that you might be a little bit more familiar with. Science majors out there, please forgive me, it's a really crude diagram, but it shows the relationship to where UV light sits on the spectrum compared to erbium YAG laser, which is around 2,940 nanometers, and where other therapies that we might be more familiar with sit, like red light and infrared light. I'm not an expert on lasers or electromagnetism, but I thought just a brief discussion, just so we all know what we're talking about, would be good. So we're all familiar with UV light and how that can damage our skin. And we're also, a lot of us who are in the skincare community are informed about infrared light and our LED lights that give us skin rejuvenation. So where does ablative laser, CO2, and erbium YAG sit on the electromagnetic spectrum? Well, if you look past infrared, erbium YAG is past that a little bit, down at 2,900 nanometers. And it was introduced in the mid-1990s as an alternative to CO2 lasers. Because CO2 lasers, they found out, they were causing a lot of heat damage and the recovery time was longer and people were having more side effects like hyperpigmentation, hypopigmentation, and scarring. So erbium YAG came in the mid-1990s, late 1990s, as a bit of an alternative to CO2 laser. So I want to tell you a little bit about why I chose to have ablative laser done as opposed to a different type of laser procedure. I talked about it a little bit in my cosmetic procedures video, but I'm going to go into a little bit more in depth. So I'd been on tretinoin for a few years. I had done the hydroquinone combination compounded formula to get rid of some hyperpigmentation, and I did have some success with that, but I still had sort of a dull texture to my skin and really deep furrows above my lips. Kind of, I call them the smoker lines or the barcode lines. And I was really unhappy with the way they were making me look and the way that they were making me feel very aged looking. And the feeling of not looking the way you feel and as youthful and beautiful as you feel inside was really frustrating to me. And so that's why I decided to do laser. I wanted to get a full ablative resurfacing laser as opposed to fractional because the end result was supposedly, in the explanation and the consultation I had, a little bit more effective at getting rid of the deeper wrinkles that I had, especially the ones on the barcode line. So that's why I chose to do a one treatment ablative laser as opposed to a multi-treatment fractional laser. I did have some consultations with two different dermatologists, one that specialized in laser and one that just is my regular dermatologist. So the important thing is you find a board certified dermatologist or laser specialist in this area that's done it for years. The person that I went to had 30 years of experience and they were at a university hospital and they were licensed and highly qualified to do the procedure that I had done. So that's really important. You want to make sure that you're going to a reputable clinician before you even consider having anything this invasive done. After my consultations, I decided to go ahead and have the ablative laser done. I rearranged my work schedule. I was told that I'd have to have about 1 to 2 weeks off work. Typically they say about a week to 10 days. And so I arranged that. I had my appointment with the nurse to go through all the steps that I would need to know about for wound healing and my aftercare. And I scheduled it. And so this is a picture of the day of my laser ablative treatment. And what they did is they gave me a nerve block. So I was awake with a sedative. So just sort of a calming sedative and then the nerve block. So I didn't feel a thing. It wasn't uncomfortable at all the day of surgery. And I left the office with a complete dressing. You'll see here a full facial covering and a net to keep the dressing in place. I came back the next day for a dressing change and to go through once again how I would change this dressing for the next 3 to 4 days. So I had to wear this complete facial cover for about 4 days. They may have extended it actually to 5 days. And it was really challenging. Each evening I would have to do a dressing change. I would get in the shower with my saline and my gauze, and I would clear off all the debris, the scabbing debris, and also all the exudate, because they don't want you to form scabs. So you have to keep the area moist and free of any type of scabbing. So every night I would have to, actually I think the first 2 days I had to do the cleansing twice a day and reapply the dressing. So it was pretty arduous those first 1 to 4 days. It was a lot of work and it was painful. I was on pain medications. I've read a few articles about a couple studies where 80% of the people don't actually need pain medications. I definitely did need pain medications. And as you can see, I'm quite red, irritated, and very sore these first few days. As you can see, during week 2, I started to have quite a bit of edema in addition to the redness, and it was actually quite painful during that week, but I didn't have to wear the full occlusive dressing, so that was a nice break not to have to wear that. I did have to cover my face after each cleansing, which was twice a day. I had to cover my face in the occlusive ointment, a petrolatum ointment, and I wore that 24/7. It was pretty uncomfortable those first few days, and the second week was a little bit more painful, I think, because I was starting to re-epithelialize, the nerve endings were starting to return, and by the third week, I had what they call pruritus.
It's actually pronounced pruritus, but the bottom line is it's infernal itching.
Not every client has this. This occurs into I think about 10 to 20% of cases, but I had really, really bad itching. And they didn't warn me about this, and so I ended up getting a few skin tears. So I didn't wear anything at night, and I was accidentally scratching myself at night. And so that was extremely upsetting at the time, and I ended up having to take Benadryl and using hydrocortisone and having to wear socks at night so that I didn't unintentionally get a skin tear or scratch myself. And you can see this is a pretty upsetting picture here where I do have a scratch. And it did end up healing down the line. So as you can see, around week 3, I'm looking a lot better. I've got a smile on my face. I'm out and about in the community a little bit. And I just wanted to say that what was really great for me personally is I had a lot of great family support. I think when you're going through something like this, especially when unexpected things pop up like the additional healing time and the skin tears that I had, it's really important to have a great support network that you can rely on and talk to. And I did. I had really great family support. So I just wanted to mention that if you're going through this, then that's a really important thing to consider. And by week 3.5, almost 4 weeks, I was ready to go back to work, but that was like 10 or 12 days beyond what I expected to take off. Thank goodness my work was quiet at the time and I was able to take that time off, but that was also something that was quite upsetting. My healing time was basically double what they anticipated, and that continued throughout my healing process. Every time I was given a landmark of what was expected, I was double. So the redness was supposed to resolve in 3 months. Mine didn't resolve, closer 6 to 12 months. And the itching and the irritation was supposed to resolve within a few days. Mine lasted for a good 10 days. Skin tears were quite rare. I had 2. So I did run into some complications that are maybe a little bit atypical, but I think it's really important to talk about them because if you're not aware of it, then you can't prepare for it. And I think emotionally, I wasn't really prepared for the couple setbacks that I had. In a couple of videos, of course, I talk about the hypopigmentation and the grid lines that I am still left with. And at the end of the video, I have a little outtake that I did during I think it was my 1-year anniversary, and I talk about what I'm doing next to take care of that. So I'm going to be doing some voiceover during this next portion of the video just to kind of take you through the healing process, and I hope you enjoy the rest of the video, and I will talk to you again at the end.
As I was digging through my video recording archives, I actually found tapes that I had recorded much earlier than I had remembered. I have tapes of week 1 and week 2, so I'll show those first and then I'll proceed to show you how I healed over the weeks and months over the next year.
I thought I would give some remasking tips because now that I'm in day 5 of remasking, I have some suggestions. So, number 1, gather all your supplies in one little bucket or bin, have everything ready to go. I also recommend tracing all your masks because by the time you've washed your face and washed the crust off, you are a little exhausted and in quite a bit of pain, and you don't want to be fussing around with cutting your mask out. So if you're remasking for multiple days, I highly recommend getting all your masks pre-measured and pre-cut. The other tip I have is, see this netting? This is fabulous. I like the way it keeps it nice and tight against my skin because when any air gets in, it really can kind of sear the skin and be a little painful. So this netting is fantastic. If your doc doesn't give you a netting, get one or somehow. Anyway, and also see I tied it up in a little knot to make it really tight under my chin, which is really nice because it just keeps all the air out. All right, my other tip is to keep your little sterile tongue pressors handy and reapply the Aquaphor in the open areas all the time. Don't let them dry out, because if you let them dry out, by the time you take your mask off and have to wash, there's a lot of crusting. And personally, I think it hurt quite a bit to get that crusting off. So reapply in the open areas and then just kind of wipe with a little tissue so you can speak and see. I thought that was a good idea. And the other thing is, I was told I could just use water, lukewarm water, to wash off the crusting. No, thank you. Get some sterile saline if you can, or make yourself some sterile water with 0.09 saline. It's called normal saline. I do not recommend just using lukewarm water. It was extremely stingy. Get yourself some normal saline for decrusting and do, like, soak before you wash off and everything. So those are my tips for masking. And so today is my last day, and so I've had quite a bit of practice with this remasking nonsense. So those are my remasking tips. I hope they help anyone out there. Day 6. Done with my masking. No more masking. Just now stay indoors and let this heal up. I have my appointment on Tuesday, so in a couple days, and between now and then I'm just supposed to wash once a day. I am definitely uncomfortable. So signing off for day 6. It's day 15. Did have a skin tear, so I'm not doing any makeup and not doing any sunscreen. I had my doctor visit yesterday, and overall, he says I'm right on track. People do get skin tears. Had some little blisters on my chin, kind of unrelated to the skin tears that were happening during sleep. Even got the skin tears wearing socks on my hands and really, doing the hydrocortisone and taking Benadryl. There I just swiped in my sleep, and the doctor said the skin just might have been a little too fragile from the 2 days that I did do some makeup and some sunscreen. So no more makeup, no more sunscreen. I'm pretty comfortable going outside, which I'm allowed to do now, dodging the sun. He said I can't stay outside, but I can go in and out of my car, short walks out of the midday sun. So I'm really pleased with how things are going. Things are really lightening up, especially on the right side of my face. And the left is still kind of sad and angry, but everything is going really well. He says I'm right on track. Everybody heals at a different rate. I have had a couple of complications with the skin tears and the excessive itching, which I thought was due to the fact that the hairs are regrowing through the new baby skin, but it's not. Evidently, it's the new formation of the nerves regenerating. So got some enlightenment on that. But all in all, I feel pretty good. I did go out yesterday to get a manicure pedicure, and I thought I looked fine, but my manicurist was like, oh my gosh, what happened to you? So anyway, I think things are majorly improving, but if you're not wearing makeup, you might be more uncomfortable, but perfect. I personally don't care. I went to the bakery this morning, as I said, dodge the sun, getting back to life. It's been 1 month and my pinkness is going away really nicely. And I had a wonderful comment. I was wearing makeup yesterday that I looked like 10 years younger. So from someone who's known me for many, many years. So I was really excited to hear that. My skin is extremely smooth. There's a little bit of, pink discoloration, but, considering how deep my dermatologist went, it's going to be pink for 2 to 3 months, like you said. So that's what's going to be, and So I'm really happy 1 month out. I am wearing some concealer makeup, pretty heavy still, but my eyes are much less pink and everything's really smoothing out nicely. I'm really happy with the result. Just continuing to use a combination of hydrocortisone when I have itchiness, mostly at night, and a moisturizer, a heavy moisturizer. I particularly am using CeraVe. Thumbs up! It's been 5 weeks and 3 days, and I wanted to show you, I woke up this morning really close to my normal skin tone. I've gotten really excited. A little bit of acne going on. During my 4-week visit, I started on some low percentage tretinoin, and it's really getting rid of the pink, getting really rid of the milia under my eyes. Got a little acne going, but the tret's kind of helping with that too. But really, my I don't feel quite so edemic anymore. No, the swelling has really gone down. Really kind of headed back to my normal skin tone, nice and smooth. No smoker lines anymore. Really happy with how things are going. The scratches that I had are all, there's no scarring from them. I continue, actually last night was the first night I didn't wear my socks on my hands because the itching has really calmed down. Kind of doing a heavy, the tretinoin with a heavy moisturizer, getting back to a little bit of my normal skin routine, adding some humectants and some light oils. And so very excited about my skin not being quite so red and pink. I'm really pleased with the results. Crease lines are diminished, my smoker lines are diminished, and things are looking great at 5 weeks. 8 weeks post-ablative laser. And this month it's been a tricky using the tretinoin that was prescribed at week 4. I was prescribed 0.025%. I tried using it twice a week and got terrible dermatitis, which is looking much better today after 4 weeks, titrating down to only once a week. It's been quite the battle. I've been having raised bumps, itchiness, I guess they call it, tretinoin related dermatitis, but I've been sticking through it once a week and doing lots of moisturizing. So that's kind of been my battle. I also had raised white lines. I've done some research, and apparently it's because the laser went over it twice. And I sent pictures to my doctor, and he said, just wait it out, you're still healing. And they have gone down. They're not gone, and I can still feel them and I can still see them, and they're more prominent kind of in the mouth area and kind of across my labial folds, but they have diminished and I'm not quite as worried. I thought maybe there were some scarring or hypertrophy that needed immediate treatment, but apparently not. And like I said, they kind of have gone down a bit. The other thing that's been going on is I'm noticing, this continued smoothing is really good, and tightening. I haven't seen the recurrence of my deeper creases in my lip line. Week 11, dealing with a lot of adult acne and milia as I heal, and there are some grid marks, but they're getting better. I'm not super thrilled with them, but they are improving, and they say by hopefully 6 months they'll be completely gone. So I'm hoping. A lot of redness under the chin. As you can see, just lots of milia, dealing with adult acne all over the holiday break, which was not fun. But I'm using some niacinamide, some multiple types of AHAs and BHAs at night, sticking with my 0.025 tretinoin. I've been able to increase it to 3 times a night. 3 times a week, so that's great. So things are going really well. Just like I said, just some grid marks that I'm not too happy with, and some acne. So week 11, this is it.
Five months post-laser, decided to come outside and give you a look at my skin in sort of a more natural light setting. Things are going really well. The discoloration is kind of fading really nicely. You can kind of see the demarcation areas still, and but still really pleased about how the texture is coming along. And of course I have my 2 layers of sunscreen on. Always. And yeah, just really pleased with the texture. Things are looking nice and smooth. I'm over sort of the whole acne disaster. And let's see what else. The milia is much better. And I had some unroofing of the larger nodules of the keratin. I think it's keratin. Anyway, the milia bumps, the white little bumps. Anyway, had some unroofing done on that, and so they're sort of cleared up. Haven't been having any acne. Been really good about my skincare though. 6 months post laser, and I'm really pleased with the results. As you know, along the journey, I've been quite concerned. Little demarcations still under here with some redness, a few little horizontal white lines. I've got a couple layers of sunscreen on. It is just a touch red, but I can cover it up with some makeup. I haven't this morning because I, just kind of really haven't gotten myself going, just taking the dog out. So overall, I'm really, really pleased. A few little hints of my lip lines coming back, but I think that's just the way I talk, and it's just going to be the way it is, the way my muscles pull. So that's what it's going to be, but I'm overall really pleased.
Hi, so it's been a year since my laser resurfacing treatment. I cannot believe it's been a year. I decided to come out and sort of show the final 1 year reveal outside in natural lighting and, before I did my skincare routine this morning and no makeup, just to sort of give you an idea of what a realistic result might look. I have significant improvement in the deep furrows along my cheek lines and over my lips. And my lips were, as you remember, one of the biggest concerns that I had. I felt like I had smoker lips, and I had never smoked a cigarette. So I am overall extremely pleased with the result. And I think if I were to do this again, I'd do multiple treatments over a year as opposed to one blast. And it really was a blast.
Despite the lovely benefits I got from the laser resurfacing, my pigmentation is removed, the deep wrinkles are gone, and the texture of my skin is so much smoother. I also was left with some hypopigmentation/grid lines, and I've been working to address these with my dermatologist. Some possible treatments are going to be medical microneedling, some light Fraxel laser, some IPL, and possible chemical peels.
So thanks for joining me today on my laser ablative resurfacing journey. I really appreciate you being here and being willing to talk about cosmetic procedures. Please leave a comment down below on procedures that you've had or procedures that you're thinking about that you'd like to share. I know that when I hit 50 and having a plan about my cosmetic procedures that I wanted to have done was really empowering for me. It made me feel more confident. It made me feel more beautiful. Now that may not be the way everybody feels about this, but I just wanted to share my journey, my experiences, and I also want to break down the shame and the stigma that has typically been surrounded by having cosmetic surgery and cosmetic procedures and tweakments. I just think there's a whole new generation of us out there, and we're living so much longer, and I just want to live purposefully, and I want to age purposefully and intentionally and live life to the fullest in my best skin every single day. So thanks so much for joining me today. Please leave an email or send me an email or a comment down below. Positive, negative, no problem. Just be respectful, and I thank you so much for joining me today. Take care, everybody. Bye.